Hi, my name is Andrew Sears, and I'm the president of City Vision University, and I'm going to give a quick overview of our Psychopharmacology of Addiction course. In most of our addiction counseling courses, we provide three kind of frameworks. One comes from the typical counseling perspective, often aligned with LPC standards, and we're using a book in this course called Drugs and Behavior, an Introduction to Behavioral Pharmacology. And then we have actually a couple of just brief books, and we're only using a portion of these books in this course. We use them in some other courses also. Addiction and recovery counseling, we're using that because it covers a lot of, specific to various substances approaches that Christians might take in dealing with various substances. And then another book called Descriptions and Prescriptions that really is about how do you establish a good theological understanding of pharmacology and establish the right balance as you relate to that. And then the third perspective is addiction specific, and we're using multiple SAMHSA's resources. They have three of their tip series that we're using on detoxification, on alcohol, and opioids. So the learning outcomes for this course, by the time you finish this course, you should be able to identify the key scientific principles of psychopharmacology, including neurotransmitters and drug adaptation and the impact of behavior, identify the pharmacological basis of addiction and the effects of psychoactive substances on the brain, evaluate the use of medications in addiction treatment and understand the different medication-assisted treatments available. Reflect on the importance of having a balanced view toward psychoactive medications and medication-assisted treatment centered around the needs of clients with a sensitivity to cultural and religious factors. Provide diagnoses and treatment plans based on case studies involving alcoholism, and anxiolytics, stimulants, opioids, and other substances, and develop strategies to refer clients to medical experts for detoxification, prescription medication, and medication-assisted treatment, and develop a psychopharmacology and addiction training manual covering a range of drugs for your organization aligned with its context and values. So as all of our courses, we follow Bloom's taxonomy, so you're going to be taking notes and reading the material. You'll have quizzes we just want to make sure you understand the basics before you get into discussion forums and live meetings. And then a lot of the work in this course is going to be doing case studies, and almost every week of this course you're going to be doing a part of the final project where you're essentially synthesizing what you learn in this course for training others in your organization. Now, one of the key issues that is covered in this course is, what's going to be your approach to psychopharmacology and medication in terms of treatment and medication-assisted treatment. Now, in other courses, we kind of explain this framework we have, counseling Christianity, 5 views, and there's kind of this spectrum. So, on one hand, you have this biblical counseling world that might be primarily pastors and Christian counselors in churches, and they're not licensed or trained in prescribing medications and things along those lines. And on the other hand, you have, groups over here that are secular, and you might have hospitals and other groups that are, their core competency is in medicine, right? So, so there's kind of a range of perspectives on how much are you going to embrace medication-assisted treatment, how prominent is the role of medication in addiction treatment. There's kind of a tendency that sometimes is critiqued that, for the doctors can take an approach sometimes where for every ill there's a pill, and that is actually a critical part of treatment for a lot of people, but there's more to it. And how much do you emphasize the pharmacological approaches versus other approaches depends on both the school of thought and your core competencies of yourself, your organization, but it also really depends on the client. So if you look at the course outcome is, we want to be client centered. So what's really going to help this person the most, right? So it shouldn't be based on your own presuppositions. And even, there's plenty of clients that are like, I will never take medication. Well, how do you work through that if that is a part of the solution for them? Or you might have other clients where, they are eager to take medication, but they just have a hard time, continuing to take it or taking it every day. That creates issues. So we want you to be very thoughtful about this. We don't want you to be kind of stuck at one end of the political spectrum. The world is polarizing, and a lot of what we'll talk about in this course is how do you not just get stuck at one of these poles? How do you recognize that, medication has a really valuable role to play, but also there are some good reasons to be skeptical of it being used too much, right? So this course looks at, really two aspects of psychopharmacology. One, the primary one is for medications or for substances that are being abused. But secondarily is, what is the role of medication-assisted treatment or other psychopharmacology for prescription medication as a part of comprehensive addiction recovery. So hopefully all this is helpful. If you have additional questions, please ask your faculty member. Thanks a lot.